Let's now proceed to differential diagnosis in Western and Chinese medicine, and let's discuss abdominal pain. Let's start with Western differentiation of abdominal pain. First, we have the gastrointestinal problems. There's in chronic appendicitis, it will manifest with recurrent abdominal pain with fever, loss of appetite, nausea, vomiting, constipation, diarrhea, chills, and shaking. If it is peptic ulcer, it will manifest with abdominal pain, typically relieved by eating. There will be heartburn, belching, chest pain, and blood in the stools. In gastroenteritis, there is upper abdominal pain, indigestion, loss of appetite, nausea, vomiting blood, or coffee ground vomit, and dark stools. In irritable bowel syndrome, there is abdominal pain with constipation or diarrhea, or alternating constipation and diarrhea, abdominal fullness, bloating, feeling of incomplete emptying of the rectum, and loss of appetite. Other causes include inflammatory bowel disease, reflux, esophagitis, lactose intolerance, food allergies, diverticulitis, fecal impaction, and carcinoma. Let's go to hepatobiliary problems. We have chronic hepatitis. There will be abdominal pain or distension, dark urine, pale stools, fatigue, itching, jaundice, weight loss. In chronic pancreatitis, there will be recurrent or chronic upper abdominal pain, mild jaundice, fatty stool, and weight loss. In chronic cholecystitis, there will be chronic indigestion, vague abdominal pain, nausea, belching, and other causes will include cirrhosis and carcinoma. Next, we have genitourinary problems. There will be dysmenorrhea with crampy lower abdominal pain during periods, lower back pain, and endometriosis. There will be dysmenorrhea, pelvic or low back pain, painful sexual intercourse, premenstrual spotting, painful bowel movements. Other causes include ovarian cysts, fibroids, pelvic inflammatory diseases. And other causes will include alcohol, drugs, myofascial tear in the abdominal wall, inguinal or femoral hernia, and vertebral lesion, and depression and stress. Now let's go to diagnostic questioning according to organ interrelationship. So stomach and large intestine or the yang ming, and liver and kidney in the shang cycle, stomach and gallbladder in the Ku cycle. So let's next look at its location. It's in the hypochondrium, epigastrium, upper or lower abdomen, and below the heart. The nature of pain will be acute and excess. If it's chronic or recurrent, or excess and deficient, could be stabbing or fixed in blood stasis, could be vague and unlocalized if there is chi stagnation, severe cramping if it's cold, dull nagging if it's due to chi deficiency. It's worse with pressure if it's excess, worse for eating if it's excess, better with pressure if it's deficiency, better with heat if it's cold, better with rest if it's deficiency, better with activity if it's chi stagnation, periodic, accompanied thirst if it's heat, and violence accompanied by fullness if it's excess. Digestive or gynecological, it will be according to external cold, internal invasion of external heat, internal heat, damp heat, repressed emotion like frustration, anger, resentment. It could be due to blood stasis that is following abdominal trauma, or surgery, or it could be due to dietary factors like eating spoiled food, excess cold, raw food, or overeating. So for the associations of these problems, it could be related to menstrual cycle and gynecological cases, or eating and defecating in gastrointestinal cases. So for the Zangfu organ pattern in excess, we can find cold invading the large intestine. It could be cold invading the stomach. It could be due to food stagnation in the stomach, damp heat in the large intestine, stagnation of liver qi, blood stasis in the stomach, liver blood stasis, damp heat in the gallbladder, or damp heat in the bladder. In deficiency, it could be spleen and kidney qi and yang deficiency, or stomach yin deficiency. Thank you for your attention.